Hi, everybody. Welcome to Scholarly Snippets. My name is Abbey Griffith. I am a medical librarian at Kansas City University. Today's session, we're going to be talking about some consumer health resources. As a reminder, this workshop is being recorded. By continuing to stay in the workshop, you are consenting to being recorded. If you do not wish to be recorded, this will be available on our YouTube channel, so you can always check it out there. A little bit about this workshop. This is part of a series to help advance your research skills and support your scholarly activities. Participants at the end of this session will be able to identify and share evidence-based consumer health resources. Okay, so what are consumer health resources? Standard medical terminology, which sometimes we call Medspeak, what doctors and medical practitioners discuss inside clinical settings, is usually very common within the medical community, but it can be very confusing for patients or laypersons, even librarians, even if we work in this. So consumer health resources really aim to bridge that language gap and provide information that is easily understood and accessible to patients outside of those clinical settings. This allows patients to make more informed decisions about their own health care and to share and participate in the conversations with their doctors and medical professionals about their own health. So what we look for with a good resource, a good consumer health resource, is that it needs to be easily read. We aim for about below 7th grade reading level. Other recommendations will be anywhere between 6th grade and 10th grade. And that is just to make sure that no matter where someone is at in their reading ability, they can hopefully understand the majority of the information that they are finding that pertains to their health. It should also be from a trusted organization, whether that be a hospital, a medical institution, a national site, a disease or condition specific site. We want to make sure that it is from a place that we can trust and a place that we know is providing evidence-based medicine content. It should also aim to be available in multiple languages. A lot of people, English is not their first language, and having the ability to read about their own health and their own conditions in a language that they are more comfortable with may be easier for them, and that may help them participate in their healthcare decisions and conversations with their physicians. The information should always be current. We know the realm of medical research is constantly changing. New information is being found, new research, new studies. And so we want to make sure that the information that patients are finding in consumer health resources are up to date and current and in line with current recommendations and best practice. There should also include a disclosure of who or what the organization providing the information is and where their funding is coming from. Some easy ways to evaluate content are pretty similar to the ways that we evaluate articles and journals and other resources. And that includes looking at the sponsor's website. Who is sponsoring this? Who is putting this information out there and funding it so that it can be accessible? How often has this been updated? Is it 5 years old? Has the information been changed but not updated on this website? Is it fact or opinion? If it is an opinion, is it clearly stated that this is an opinion? Or is it biased and leaning towards something, but not clearly stating that? Because that can be a red flag and a concern with consumer health resources. We also need to be aware of who the intended audience is. There is a difference between a medical professional's ability to understand information and lay people's ability to understand things. I will read things that our students are writing or talking about and have no idea what they are talking about because I don't have that level of medical understanding. And so we need to make sure that the intended audience is who we are giving this information to. And lastly are ads. Is this site promoting something? Are they trying to get you to buy something? If there are ads up and down the left and right of the page, ads that are popping up in your face trying to get you to purchase something or click another link. That can be a red flag as to the intention of this site and whether or not it should be something that people are using for health information. So we've all heard about Dr. Google going on WebMD and finding out, looking up your symptoms and coming away terrified with something. Everybody's got kind of the joke about that. But it's important to think about how the internet and access to health information has really changed the way that consumers and patients are interacting with their own health. If we think back, what did consumer health resources look like in the past, our grandparents or our parents' era? How have things changed? Not only in regards to the medical literature and the research, but also how people are able to find these things. As we have new technologies and we have the ability to do more things on our computers and interact with more people, that's going to change the way that consumer health resources look and how people are using technology to access those resources. So searching for health information is the third most popular use of internet technology. And 1/3 of American adults have actually gone online to figure out a medical condition. I am one of those. I do that a lot. And Pew actually did a study back in 2013 that found that 59% of US adults have actually looked for health information online in the past year. So between 2012 and 2013, 35% of them had used it to try and determine a medical condition or something that they think they may have. And those are called online diagnosers or the Dr. Googlers. 53% of those folks went on to have a talk with their clinician about what they were able to find on the internet. And 41% actually had that online diagnosis confirmed by their clinician, which is a pretty cool thing, which means that, maybe they were getting some good information. And that's what we aim for these resources to do. But as the resources and information and research grow and change, the technology also needs to grow and expand as well so that people are able to get the best information possible to make informed decisions about their own health care. Some places to look for these consumer health resources. There's a number of websites. I cannot possibly list them all, but some great ones to start or to look into are places like the National Institutes of Health. They do have specific sites. Of course, we know the NIH is this massive umbrella that kind of encompasses everything as far as medical research and information goes in this country and really the world. But they do have more specific sites that are aimed at conditions or diseases or just patient information and consumer health resources. The CDC, Center for Disease Control and Prevention, also has a lot of resources available on their site. They're very intentional about the reading level that they put on their information so that it can be understood by the majority of people. And that's one thing that we always look for, of course, in these types of resources. Medline Plus is a great resource, also in that 7th grade reading level or below. And the really great thing is that it can be available in a number of languages. There are a lot of languages that you can find consumer health resources in Medline Plus. Other websites are things like Kids Health, where parents can go to find information about their children's health or conditions to have those conversations with their children's pediatricians about their concerns or about a condition that their child has. FamilyDoctor.org, that is through the American Academy of Family Physicians. That's another great consumer health resource that people can access. The USDHSS, Office of Minority Health, has a lot of great consumer health resources put out there and put in specific language that people can understand and at that reading level that we're looking for. There's also a number of condition and population specific websites. Sites like cancer.gov have consumer health information for folks going through cancer treatment or needing more information about that. Diabetes.gov also has a lot of consumer health information. The National Institute of Health on mental health also has tons of resources and information available to patients and lay people who just want to know more about conditions and situations that they're in. On the flip side, from the academic and clinical side, there's also patient education resources, which are not quite the same thing as consumer health, but they do play a role in that. And these are subscription things that we are paying for, that hospitals are paying for, that are providing specific patient education handouts and resources that can be printed out and given to a patient. These are also written in this lower 7th grade reading level language and kind of more clear cut to define conditions or diseases and treatments and options for patients. These are things like Clinical Key, Up to Date, Access Medicine, Consumer Health Complete, and Dynamed. And these are things that clinicians may have access to, or they may not. It depends really on the institution that you're working at. And that's why it's important that we teach our students about these other websites as well, so that if they find themselves in a situation where they've used Up to Date with us throughout their medical education, but they no longer have access to it once they're through their residency and working in a more rural setting, they can still find good quality consumer health information that's trustworthy that they can share with their patients in the future. There's also a number of medical dictionaries available to help interpret that Medspeak. Merriam-Webster has an online medical dictionary that can be very helpful. The Medical Library Association also has a number of pages on their site to one that helps you with finding quality consumer health resources and reputable resources, and another that is called What Did My Doctor Say? And this is just basically a giant list of terms and the definitions of them. And I refer to that a lot because I know a little bit, but not enough to always know what my students are talking about. And so that can be really handy for librarians to use. There's also disease and condition specific dictionaries. The National Cancer Institute has a dictionary specific to cancer terminology. So that'll be things like treatment options, some drug information and stuff like that, so that cancer patients can look up these terms whenever after they've had a conversation with their doctor to be more informed about their health care. But it's important to note that not all medical dictionaries are the same. You know, you've got to know your audience. Is this meant for a medical professional, or is this meant for the general public? Most of us have Stedman's medical dictionary sitting on our shelves in our libraries, but is that something that the average person is going to have access to or be able to understand all of the definitions in? Probably not. So how do consumer health resources and research tie in together? It's important to think about where the information for consumer health resources are coming from. The ideal is that they're coming from evidence-based medicine and clinical practice guidelines. That is the peak of our research pyramid, right? That's what we aim for, that's what we strive for, and that's where we want that information coming from for two reasons. One, we want our doctors and our clinicians to be using these clinical practice guidelines in evidence-based medicine in healthcare. And we want those patients to be having access to that information in a way that they can understand it as well. And the way that research works, of course, is it's a pyramid. You're building up from the bottom. Each level builds onto the next level until we get all the way to those clinical practice guidelines. So what you're working on in an animal or laboratory study may not be something that's directly impacting or creating a consumer health resource, but it is part of the process to get us there. You cannot get to the peak of the pyramid unless you start at the bottom. So those bottom layers, those bottom two layers are really where we're developing the ideas, the thoughts, and the technologies that are leading to the advancements in medical research that eventually get us all the way up there to that top peak. And no matter which part you are of the pyramid, you're playing a role in the biomedical research sphere, and that is going to help us generate better health resources in some manner in the future. And it's also important to note that consumer health resources are an area of research. People do research these things and look into better ways to communicate with patients and get this information out there and really evaluate and create best practices in creating consumer health resources for the future. So that is really all that I have on consumer health resources. If you have any questions, I can try and answer them now. If not, my contact information is on the screen. You can contact me anytime at my email at agriffith@kansascity.edu.
I just put a link in the chat to a survey that would really appreciate everyone to fill out if you get a chance, as well as a link to our YouTube channel where this will be posted in the next couple of days, and also a registration link for the next Scholarly Snippets workshop.
Yes. Reference Managers 101 will be our next one on September 20th, I believe, right?
Yes, that is correct. Yeah. Well, thank you very much, Abby.
Thank you.